Do you have a friend who wants to know what is gonorrhea and how can you know if you're having one of these episodes with gonorrhea? My name is Garcia Cruz, I'm urologist, and for more than 15 years I've been helping my patients with sexual issues such as sexually transmitted diseases, and that's what this video is about. How do you know that you have gonorrhea? What's gonorrhea? How you figure that out, that you're having this issue? Gonorrhea is the illness produced by Neisseria gonorrhea, which is a bacteria, a sexually transmitted disease bacteria. You can get this bacteria not only through vaginal intercourse but also through rectal and oral intercourse. So it's very important to use condom during the whole span of the sexual relationship to try to avoid being infected with gonorrhea. Which are the symptoms of the disease? The main symptom of this disease is called urethral discharge. It's also technically it's called blenorrhagia, but it's a much lesser, less common denomination. So what you might be experiencing is the production of a whitish liquid through your urethra. That's what it's called, urethral discharge, and a sensation of itchiness in your urethra. Very typically, gonorrhea appears during the first month of risky sexual relationship without condom. Although, if you're having sexual disease with condom, it's also possible, though much more unlike, that you will end up having gonorrhea. What do you have to do if you suspect that you're infected with gonorrhea? You should avoid having sexual relationships for sure. I would advise you to go to your general physician or your urologist, so he or she will perform on you a sample of, she or he will get a sample of this whitish liquid to send it to the lab and culture it to see if that's the bacteria that's affecting you. The main other diagnosis instead of gonorrhea could be chlamydia, which is the other main bacteria producing urethral discharge. And in any of the case, the treatment of this situation is antibiotic. So you will be given a shot of penicillin or an alike product, plus some oral treatment per 1 or 3 days. Let's consider that depending on your country and the sensitivity of the bacteria in your country, the antibiotic therapy might vary somehow, but still the main treatment is a shot of ceftriaxone, which is an alike penicillin, plus azithromycin. Although, as I mentioned, that's something that can differ country to country. Anyways, gonorrhea raises your chances of having other sexually transmitted diseases, and that's very important because if you're suffering gonorrhea, which is a not very important infection if you treat it early, but you're at risk of having other sexually transmitted diseases. And that's why, if you're having urethral discharge, I strongly advise you to go to your urologist or your general physician so you can be checked and everything will be fine afterwards. Hope this video was useful. If so, please hit the like button and subscribe. You know that I have a friend who we have tons of videos about urology and sexual function. Bye.